I have a genetic diagnosis, but there isn't a treatment. Now what?
While one of the most exciting aspects of epilepsy neurogenetics and the new diagnoses that we're making is the potential for treatment-specific options, we really aren't there for all of the diagnoses that we are able to make. And so I think many families find themselves in this position. So I would encourage families to continue to work with your child's treating team, remain educated about your child's diagnosis and ongoing trials and treatments related to it. But know that you aren't alone in that scenario. Now, when we think about treatment-specific options for genetic epilepsies, I think that they fall into three categories. So the first are existing medications that, based on the medication's mechanism of action or what we know about how the actual genetic change works and affects the child, we know from experience and from studies that certain medications have better outcomes in certain genetic diagnoses, while other medications can actually make seizures worse in those genetic diagnoses. So based on that information that we've just gained over the years, your child's treatment team may have suggestions based on the existing medications that weren't created specifically for that gene, but that we know work in a better or worse fashion for treating seizures based on that. The second category are newer medications that have been studied only in a specific genetic condition and therefore have only received FDA approval to be prescribed for patients who do have those specific genetic conditions. And then the final category, which is really in the infancy stages, are actually gene-specific treatments. So genes or medications or therapies that really work at a molecular level to target the genetic change or the abnormal protein that results from that genetic change to really alter the function of that gene and attack the seizures in that way. We are in the infancy stages of doing this with a handful of genetic conditions. And I think that the hope is that this will expand and become more commonplace. But there are ongoing clinical trials for, again, just a handful of treatments. So I think most families will not find that one of those categories is where their child fits into. And I don't want them to lose hope, because don't forget that we do still have our mainstays of treatment for epilepsy across the board. So we have pharmacologic options, which are medications. We have dietary therapies, things like the modified Atkins diet, the ketogenic diet. We also have surgical options within epilepsy, and that can include intracranial treatments such as resective surgeries or corpus callosotomy, but also neurostimulatory devices, things like the vagus nerve stimulator, the responsive nerve stimulator, and deep brain stimulation. And within each of those categories, we're making new discoveries, and we really do have great options that really can significantly impact a child's life and their seizure burden.